I'm Miranda Green, and I'm here with Linda Marchioni, an emergency room and surgical nurse for over 20 years. And I'm just going to ask you a couple questions about Ontario's healthcare and what you think of it. So, the first question, what do you think of the current healthcare system we have here in Ontario?
Well, I think in general, Ontario's healthcare system is very good with OHIP compared to other countries. It's extremely good that we're very lucky to have the system that we have in place where if you're sick, you don't have to worry about how you're going to pay to be treated for it.
So, what improvements do you think Ontario could make to the healthcare system in the future?
Well, as a nurse, I've seen mainly the shortage of nursing and also ambulance care. So in general, I think we need to hire more nurses. Hospitals are a business, so I think they do cutbacks, and unfortunately the first thing that they seem to cut back is the healthcare workers, the frontline workers, which in the long run doesn't help at all, because the less care that you have, or the worse care that you have, then you're just going to end up coming back, and in general that doesn't help with the money at all. And it makes it very difficult for nurses to give good care when they're overstressed and they're looking after too many patients. So I think we need more nurses.
So what noticeable changes have you noticed in the past 20 years of being a nurse, like from when you started as a graduate to now?
I think we used to have more nurses, and I think that's where I see the main cutbacks, where you used to have a certain number of patients. That's really increased a lot because there's not as many nurses out there. Wait times have increased. Again, there's the population, the elderly population has gotten larger, and so then there's less beds for them in nursing homes, which everything ends up then going backwards. So then there's greater wait times in emergency because you don't have any place to transfer the elderly after that. So they go to the medical beds, and then the medical beds are taken up. And then when you have patients in emergency that need to go to those beds, they're being taken up by patients that are waiting for long-term care beds. So everything gets backed up.
So speaking of the elderly, most recently Deb Matthews, the Minister of Health, is partnering with Kathleen Wynne, and they're pushing for better health care for seniors in specific because they think that's the future. So what do you see happening the next decade with that, with the seniors? Think it will get better? Or?
Well, I'm not too sure population-wise. I know we have a high senior population now, but I guess the demographics of that will change over the years too. But I know they've made a lot of changes where where the government has transferred the funding more into community care, which I believe is a good thing because, as I said, there's such a shortage of hospital beds, and then if you can get patients out with good care within the community, then they'll be taken good care of there, and then they're not taking up hospital beds for patients that actually need to stay in the hospital.
So what are the job opportunities like for recent nursing graduates? Is it competitive now, or is it...
Well, right now, I am a nurse that has 20 plus years experience, and I'm looking to go back right now part-time, and I'm finding it very difficult to get a job. So it's interesting because of all the cutbacks. I think the hospitals are trying to save money, and I think it's almost easier for new grads actually to get jobs in certain areas of the hospital because of course with any hierarchy of jobs, with the new grads, they don't have to pay them as much as nurses that have 20 plus years experience. So they can basically hire 2 new grads for the same amount as they'd have to pay a very experienced nurse. So it's harder for people that have been in the profession for a long time to re-enter the nursing profession, re-enter the workforce. But I think for new grads, if they're not too picky about where they want to work, there is jobs out there for them.
So our presentation, we're talking a lot about college and university health plans. So do you know anything about that, or have you seen any situations where someone doesn't have a proper health plan and they need care?
College and university health plans?
Like plans that we get through the school from being a student, discounted plans.
Oh, I don't know too much about that, but I know they're available. I know you can buy certain extra health insurance too from the public schools, but I don't know too much about that.
Okay. So what do you think about America's health plan, Obamacare, versus our Canadian health plan?
Well, as I said, OHIP and the Canadian healthcare system is excellent. Basically, no one will get turned away because they can't pay for their health care, or they don't have to get sick and then worry about how they're going to pay for it, which will just increase the length of their illness because it's so stressful. And I believe, I don't know too much about that either, but I know with the Obamacare, I believe they're trying to bring that into America as more government-assisted healthcare, which I think is an excellent idea for people that have a very difficult time paying for their plans. I think they still have to pay for it, but I think it's more government assisted. So I think they're moving in the right direction.
Okay, well, thank you very much for your time, Linda. I appreciate it.
You're welcome.
And